Greetings to all our health enthusiasts and curious minds out there. Today we dive into a serious topic, one that affects us all, regardless of where we live or who we are: the top 10 killer diseases globally. It's a sobering truth that despite our advancements in technology and medicine, diseases continue to be a looming threat to humanity. They are invisible enemies that do not recognize borders, social status, or personal achievements. From the scorching deserts of Africa to the icy terrains of Antarctica, no corner of the globe is safe from their reach. Over the next few minutes, we'll uncover the extensive global impact of 10 such diseases. These are not just mere ailments, but ruthless killers that have claimed and continue to claim countless lives across the world. We'll be delving into the likes of heart disease, which remains the #1 cause of death worldwide. We'll also discuss respiratory diseases such as pneumonia and chronic obstructive pulmonary disease, which have a profound impact on both the young and old. We will take you through the chilling reality of infectious diseases like HIV/AIDS and malaria, which have been particularly devastating in lower-income countries. We'll shine a light on diabetes, a silent killer that is on the rise due to our changing lifestyles. And we can't forget about cancers, a group of diseases that affect people in every corner of the globe, regardless of age, gender, or socioeconomic status. We'll also tackle neurological diseases such as Alzheimer's and stroke, which not only rob individuals of their health but also their identities. And let's not overlook the impact of kidney disease and liver diseases, often underestimated but deadly nonetheless. As we venture into this exploration, remember, knowledge is power. Understanding these diseases, their impact, and the havoc they wreak on a global scale is the first step towards prevention and control. It's a journey of discovery, but more importantly, a journey towards a healthier, safer world for us all. So let's dive in, and remember, every step we take towards understanding is a step towards a brighter, healthier future. Numbers don't lie, and the statistics surrounding these diseases are indeed eye-opening. Let's break down these figures to better understand the impact of these 10 killer diseases globally. And remember, these are more than just numbers. They represent countless human lives. Starting with cardiovascular diseases, the World Health Organization reports that these conditions claim more than 17 million lives each year. That's nearly a third of all global deaths. Cancer trails closely behind, accounting for nearly 1 in 6 deaths worldwide. That's almost 9 million people whose lives are cut short by this disease annually. Chronic respiratory diseases like COPD and asthma affect hundreds of millions of people across the globe. More than 3 million people die from these conditions each year, making them the third leading cause of death worldwide. Diabetes, a metabolic disorder that affects the way the body uses glucose, impacts over 400 million people globally. Each year, roughly 1.5 million people die due to complications from diabetes. Alzheimer's disease and other forms of dementia affect nearly 50 million people worldwide, and this number is expected to triple by the middle of this century. Lower respiratory infections such as pneumonia and influenza claim the lives of over 3 million people each year, making them the deadliest infectious diseases globally. Kidney diseases account for over 800,000 deaths annually, while liver diseases, primarily cirrhosis and hepatitis, cause about 2 million deaths each year. Tuberculosis, though curable, still takes the lives of over 1 million people annually. Lastly, HIV/AIDS, one of the most devastating pandemics in human history, affects nearly 38 million people worldwide, with about 1 million deaths each year. It's clear from these figures that no one is immune, and these diseases continue to pose significant health threats worldwide. But remember, knowledge is power, and understanding these numbers is the first step in fighting back against these global killers. Scene script. Age and sex can play a role in disease susceptibility. Let's delve into how these diseases affect different demographics. You see, not all diseases are equally distributed across ages and genders. Certain diseases show a clear bias towards specific age groups or genders. For instance, prostate cancer is unique to males, and its likelihood increases with age. On the other hand, osteoporosis is more prevalent in postmenopausal women due to a decrease in estrogen levels. Let's consider Alzheimer's disease, a form of dementia that affects memory, thinking, and behavior. It's most common in people over the age of 65, and is twice as likely to affect women as men. Why is that? Well, one theory suggests that since women generally live longer than men, they have a higher chance of developing Alzheimer's. On the flip side, heart disease, often considered a man's disease, is actually the leading cause of death for women in many parts of the world. Yet it's often underdiagnosed in women due to different symptom presentation. Now let's talk about children. They are not just small adults. Their bodies are still developing, making them especially vulnerable to certain diseases. For example, pneumonia and diarrhea are among the leading causes of death in children under 5 worldwide. What about infectious diseases like HIV/AIDS? Young women between the ages of 15 and 24 are twice as likely to be living with HIV as men of the same age group in sub-Saharan Africa, due to a complex interplay of biological, social and cultural factors. These patterns are not just interesting trivia, they're vital clues for doctors and researchers trying to understand, prevent, and treat these diseases. By identifying who is at risk, we can promote early detection, tailor treatments, and hopefully, improve outcomes. Disease does not discriminate, but understanding these patterns can help in early detection and effective treatment. It's not all doom and gloom, the world is fighting back and progress is being made. Across the globe, individuals, communities, and nations are rising to the challenge, making strides in the battle against these 10 killer diseases. From scientific research and vaccination campaigns to public health initiatives, the global response has been robust and determined. Let's take a moment to appreciate the tireless efforts of researchers and scientists who are working around the clock to unravel the mysteries behind these diseases. Their dedication to finding effective treatments and cures is nothing short of inspiring. Across laboratories worldwide, new medical breakthroughs are being made, innovative therapies are developed, and life-saving medications are being brought to market. Equally important are the vaccination campaigns that are being carried out in countries around the world. These campaigns are not just about delivering vaccines. They involve educating communities about the importance of immunization, overcoming vaccine hesitancy, and ensuring that vaccines reach even the most remote corners of the world. These efforts have already led to significant reductions in the prevalence of several diseases, and the hope is to see this trend continue. In addition to these, public health initiatives play a crucial role in disease prevention and control. These initiatives promote healthy lifestyles, improve access to healthcare services, and build robust health systems that can respond effectively to disease outbreaks. They also focus on reducing health disparities, so that everyone, regardless of their socioeconomic status or geographical location, has an equal chance of leading a healthy life. The global response to these diseases also involves international cooperation. Governments, nonprofit organizations, and private entities are coming together, pooling resources and sharing knowledge to combat these diseases on a global scale. While the fight is far from over, it's important to remember that every small victory brings us one step closer to a world free from these diseases. The progress made so far is a testament to human resilience and the power of collective action. While challenges remain, there's hope on the horizon thanks to these global efforts. As individuals, we're not helpless. We can play a significant role in disease prevention. Our health is largely in our hands, and the decisions we make every day can either put us at risk or protect us from these killer diseases. One of the most impactful choices we make is how we live our lives. This includes our diet, physical activity, and habits like smoking or excessive drinking. A balanced diet, rich in fruits, vegetables, lean proteins, and whole grains, not only keeps our bodies functioning optimally but also boosts our immune system. Regular physical activity, on the other hand, reduces the risk of heart disease, diabetes, and some cancers. Then there's the matter of harmful habits. It's no news that smoking is a leading cause of lung cancer and that excessive consumption of alcohol can lead to liver disease. Making the choice to quit smoking and moderate alcohol consumption can significantly reduce your risk of these diseases. Vaccinations are another crucial aspect of disease prevention. Vaccines have been instrumental in controlling, and in some cases, eradicating diseases. By getting vaccinated, we not only protect ourselves but also contribute to herd immunity, protecting those who cannot be vaccinated. Regular medical checkups are also essential. These checkups can help detect diseases early, increasing the chances of successful treatment. They also provide an opportunity for doctors to give advice on disease prevention based on your unique health profile. Lastly, staying informed is vital. In this age of information, it's easier than ever to access reliable health information. By staying informed, we can make better health decisions and be aware of the latest advancements in disease prevention and treatment. Remember, every step we take towards maintaining our health is a step towards a healthier world.